Today, we're diving into the incredible story of a doctor who was essentially kicked out of the very system he was trying to save. It's this powerful tale about what it really costs to be a whistleblower, about immense personal sacrifice, and, amazingly, how a massive crisis gave birth to a revolutionary AI that could totally reshape healthcare as we know it. So let's get into it. And this quote from the man himself, Dr. Kalyali Srivatsa, well, it just sums it all up, doesn't it? He saw a future that the medical establishment simply did not want to look at, probably because the truth was, really inconvenient. I mean, think about it. While everyone else was celebrating just how far modern medicine had come, Dr. Srivatsa was already seeing this storm brewing on the horizon. We're talking way back in the 90s. He was this voice in the wilderness, warning that our dependence on antibiotics was going to lead to a superbug crisis, a crisis that could send us back to a time where a simple cut could actually become a death sentence. But speaking an inconvenient truth, well, it always comes at a cost. And that brings us right to the heart of his story, his absolutely grueling ordeal as a whistleblower just trying to keep patients safe. This timeline really shows you how it all went down. Back in 2003, he developed an early version of his Maya system to help staff. A good thing, right? But by 2004, he was sounding the alarm about a serious ethical problem. Nurses with no medical qualifications were diagnosing patients. And for speaking out, he wasn't celebrated, he was punished. It all came to a head in 2010 when he was removed from the NHS performers list, which kicked off this massive legal fight.
And you have to understand, he wasn't trying to make trouble. He was literally trying to uphold his oath to do no harm. But for that, he faced what he himself called a torturous conspiracy, a deliberate effort to shut him up, all for trying to protect the very patients the system was supposed to serve.
And this just lays out the brutal, devastating reality for so many medical whistleblowers. It isn't just about losing a job. We're talking about total professional isolation, being harassed constantly, complete financial ruin, and just an unimaginable toll on your mental health. He was fighting a powerful culture of silence that cares more about protecting the institution than the people it's meant to help. So what do you do when the system you've dedicated your life to just turns its back on you? Well, facing professional ruin, Dr. Srivatsa didn't just give up. Instead, he looked to the past for answers, and he found inspiration in some of history's greatest medical pioneers. This was going to change everything. He discovered this kind of golden thread, an idea that connects three totally different moments in healthcare history. He saw this direct line from the ancient wisdom of Acharya Charka through the game-changing reforms of Florence Nightingale, leading straight to the core principles he built right into Dr. Maya AI. So first, he went way back to Acharya Charaka, one of the founders of Ayurvedic medicine. And his core principle was both radical and incredibly simple. You can't just treat the disease. You have to understand the entire person, their story, their life, their world. True healing is personal. It's not just a one-size-fits-all protocol. And then he looked to Florence Nightingale. We all have this image of her as the lady with the lamp, right? But that's like half the story. She was a data geek, a data analyst during the pre-antibiotic industrial revolution. She used statistics and patterns to prove that the system itself, the dirty, unsanitary hospitals, was killing more soldiers than the actual fighting. She used evidence to challenge a broken system. Sound familiar? So you take this ancient wisdom, you blend it with the spirit of a 19th century data-driven reformer, and you apply it to a 21st century problem. And what you get is an AI born from crisis, designed for our new post-antibiotic era. This right here is the turning point. Cast out of his profession, career in tatters, Dr. Srivatsa, in his retirement, taught himself artificial intelligence. I mean, think about that. If the old system was broken beyond repair, he decided, fine, I'll build a new one. He was going to pour his 50 years of clinical wisdom into an AI that could help everyone. So how does this thing even work? It's actually beautifully simple. You just tell the AI what's wrong. And instead of some complicated, scary algorithm, it uses this really intuitive, color-coded system to see patterns, kind of like how an experienced doctor's mind works. Then, it helps you understand what might be happening and guides you to the right next step, whether that's just resting at home, talking to a pharmacist, or seeing a doctor. And this quote, this gets to the absolute heart of the technology. Dr. Maya AI is not here to give you a scary diagnosis or try to sell you something. Her whole purpose is to start a conversation to prevent a small problem from becoming a big crisis and to empower you with knowledge. She's a guide, not a judge. Okay, so this brings us to the really big picture stuff. Why this isn't just one doctor's cool invention, but why it might just be the beginning of healthcare's next big revolution.
Let's ask a really serious question. That post-antibiotic era Dr. Srivatsa was talking about all those years ago, it's not coming anymore. It's here. Superbugs are a real and growing danger. So in a world where our miracle drugs are starting to fail us, who's going to save us?
And the answer might not come from a big pharma lab. It might not be a new pill at all. The answer could be a fundamental shift in how we think, a new approach that's all about prevention and putting power back in the hands of the patient. And the potential impact here, it's just staggering. Look at this number, 85%. That's the potential reduction in unnecessary doctor visits that a tool like this could achieve. Just stop and think what that would mean for our swamped clinics, for emergency room wait times, for burnt-out doctors and nurses everywhere. But this isn't just about big abstract systems. This is about you. It's about having a tool that helps you make smart health decisions for yourself. It's about protecting your family by spotting infections before they get serious. It's literally a survival tool for this new era. And maybe most importantly, it's designed to break down all the old barriers: language, literacy, and cost. So in the end, this is so much bigger than just another app on your phone. It's a movement. It's a return to those core principles of Charka and Nightingale, a movement to put the individual human being, not the system, back at the absolute center of medicine. It's about restoring the whole point of healthcare in the first place. We'll leave you with this final thought. For so long, the healthcare system has run on a model that kind of profits from our fear and our dependency. Dr. Srivasta's story and his invention offer us a different way forward, a path of empowerment, of knowledge. So the question really is, are you ready to reclaim your free will?